That's for the OU win over Kansas.
Right, thank you. Oops, I just added a slide. Okay, invocation this morning is going to be Bob Ussery. Bob,
guess better get my act together, huh? Pray with me. Lord, love you. Thank you so much for this day, for the opportunity we have to just wake up. Thank you for Rotary. Thank you for John Buck as she leads us this year. Thank you, Lord, for our board of directors and all the folks that make things happen. Ask, Lord, that you just bless our lives today. Help us to turn and to bless someone that's beside us, around us, and help us, Lord, to bump knuckles or bump elbows, and just allow those to be hugs that someone needs today. Sure love you, Lord. Thank you for what you're going to do in advance. Help us, Lord, to go out into our world and make a difference. You're sure a good God. We ask these things in your precious name. Amen.
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 Okay, Keith is going to give us the pledge and the four-way test.
Join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. The four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned?
Thank you, Keith. Okay, do we have happy dollars this morning? Anybody happy this morning? I have a happy dollar. We had my my granddaughter's 1 year birthday party was at my house on Saturday. It was very small, just family, but she's got 3 grandmas, so it was a few people, but it went great, and she's precious, and it was a lot of fun. So that's what I'm happy about today.
Well, I don't know how I'll give it to Linda, but I'll give the happy dollar for the OU win over Kansas.
Nice.
And the Thunder pulled it out late last night too. So we're 2 for 2, or maybe we're 2 for 3. I think they lost to the Clippers, but.
Thanks, Mary. Anybody else?
Well, I'll give a happy 5, and this is kind of early. I'm leaving tomorrow with my grandmother to go see my mom and celebrate their 70th and 90th birthdays.
Nice. Are you flying there, Jennifer?
We're flying, yes.
Okay, well, good luck. Any other happy?
Where is that, Jennifer?
Naples, Florida.
Oh.
God's waiting room. Just kidding.
Well, I hope it's warm there.
It's a little chillier than normal, but it's warmer than it is here.
Great. Great. Do we have any other happy dollars?
Can you hear me?
Can.
So I can't remember if I've shared this with this group or not, but we have a grandchild coming in July. So Madeline and Hunter, who got married last July, found out about 12, 14 weeks ago, it seems like, that they have a little girl on the way. So we're excited about that.
Congratulations.
Congratulations.
Thank you. And as a follow-up to that, my oldest son, Ben, has proposed and is engaged to the preacher's daughter. So things are moving along at the Bryant house.
Very nice. Very nice. All right.
John,
any other happy dollars?
Yeah, Bill Wallace, I'll give 5 happy dollars for the first time doing a happy dollar, and we have programs scheduled all the way through February. So thank you everybody who helped with that so far. So, and if I need to do another one, I have chocolate pudding again this morning at Rudy's. So I'm very happy.
Great. It looks like Bill's a permanent fixture at Rudy's on Tuesday mornings. So if anybody
forward.
gets hungry for a burrito. All right. Anybody else? Okay, Vicki, you want to talk about the happy hour tonight?
Sure. Good morning, everybody. We're going to have happy hour this evening at Blue, starting at 5 o'clock. We'll go till 6:30, come have pizza and a little fellowship. We will do that safely. And if you're planning on coming, if you don't mind just shooting me an email or a text message today, so we can just let them know how many to expect. But hope to see several of you this evening. Thank you.
Great, thanks. Vicki, write me down. I'm going to be there.
Okay, great. Look forward to
Sarah, you're welcome to join us. We can meet you in person.
I miss happy hours at Blue. I saw that on your email and I got very jealous. So you may see me there. I'm
They
tempted.
have great pizza.
Yeah.
And great bargain well drinks. So, all right. Connie, do you want to talk about the district service project?
Yes, good morning, everybody. So District Governor Tim Eaton is spearheading a district service project, kind of similar to what United Way does on their day of service. It hasn't been officially named yet, but it is scheduled for April 24th. I'm working with the club presidents in Norman to make a one Norman large service project. And we're going to need some help. We're looking at putting it on in a park. It'll be each club picks a nonprofit to benefit from it, and we'll then get wish lists from that nonprofit. We'll publicize that to the community, and then we'll sponsor a drop-off for donations. And while we're at the park, then we can also do a cleanup at the park. So there'll be plenty of opportunities for service and for fellowship and just a all around good time. So if you would put April 24th on your list, we would like to get a club rep from each club to help with the planning on this. So if you have interest in that, you can contact me or contact Jonna, and we'll get it rolling. We're about 3 months away, so.
That sounds great.
Okay.
April, this is spontaneous, but I had noticed that you posted that right now there's a need at Food and Shelter in their pantry. You want to mention that?
Yeah, we just seeing continual growth in need and are serving a lot more people. So our food pantry is pretty empty right now. We can use just anything you would feed your family. Boxes of cereal, box dinners, macaroni and cheese, pasta sauce, all that kind of stuff. Anything you feed your family, our guests would like to have as well. So, and that can just be dropped off any day of the week here. Thank you.
Great. Do we have any other announcements?
Yes, I have one. The proposed board for next year, not this year, but next year beginning in July was sent out about 3 weeks ago, and the deadline for voting was last Friday. And I'd like to announce that there was a unanimous approval by the board members to approve that proposed board. And secondly, I have completed the committee assignments for next year, beginning in July. About 3/4 of our club volunteered, and 1/4 I more or less randomly assigned to open spots. So I will be sending that out, and I'd like for anyone who is designated on a given committee, if you want to change, just give me an email or a text and I will easily change that. So review it when I send it out and let me know if you want to change.
Okay. All right. Thanks, Jack. Do we have any other announcements? Okay, we're moving pretty quick this morning. We're going to move on to our program now. We want to welcome Sarah King. Sarah is the Community Health and Education Planning Lead for multiple counties, including Cleveland County. And so Sarah is a Norman native, born right here at Norman Regional Hospital, and went to OU and has her bachelor's and her master's from OU. And so welcome, Sarah. And I'm going to stop sharing my screen so people can see your pretty face.
Good
And
morning.
good morning.
Thank you so much for
Morning.
having me. Can you hear me okay?
Yes.
I see one familiar face out there with Joan, so I know this information probably won't be fresh to her, but Joan, if I forget anything, definitely ping me and let me know.
Okay.
But good morning. Yes. So thank you for the introduction. Thanks for having me. I hope you guys are doing well this Tuesday morning. Just to start, I didn't put together any kind of visual presentation because really information changes so quickly that I'd rather be able to have a conversation with you and an agenda and pivot what I need to on my own. So that's kind of where we're going to operate from. And I'm happy to take questions along the way, or if you want to wait till the end, whatever is most comfortable for you all. I hope I can answer some questions just without you having to ask them, but otherwise definitely let me know what you're thinking and wondering about. So as introduced, my name is Sarah King and I am with the Cleveland County Health Department. I office out of Norman. My position is regional. So health departments, and this is important context for kind of what you hear about with vaccine distribution. So Oklahoma has two independent health departments. So that's Oklahoma City County and Tulsa County. They have different reporting entities, different funding methods, all of that. So then everybody else falls under the umbrella of the State Department of Health. And they have districted out counties together to become 9 different districts across the state. So I represent District 6, and that includes Grady, McLean, Cleveland, Pottawatomie, Seminole, and Hughes. And so that's important because as you hear information or kind of wonder what's going on per health department, you know, some of our smaller health department counties, they have just a few on-site clinic staff because really what they typically provide are family planning services and that type of thing. So they don't necessarily have the bandwidth for an entire response within their own county. So that's where we kind of band together in this and are all umbrellaed together. And that's what you may hear when you hear different districts and that type of thing. So just to kind of put that in context. So where we are with numbers, I'm sure that this is really a big point of information for many. As of yesterday, this is fresh stuff. About just under 320,000 vaccines in total have been given in the state of Oklahoma. About 277,000 of those are prime dose, and about 30, almost 40,000 people have had a completed series of the vaccine. So in Cleveland County, we've had about 20,000 people vaccinated. I think that's mostly just with their prime dose, but that information wasn't super specific in there. The other portionment that the state has received goes to CVS and Walgreens. So there's a federal partnership that exists with CVS and Walgreens to be able to provide vaccines for long-term care centers. So that's been something that as we hit phase 1 in mid-December, they've been really charged with having some of those vaccines or administering those vaccines at these nursing homes or long-term care centers. So if you're hearing or have family members who have not received that vaccine yet, it's likely because they fall under that program. These entities had the option to opt in or opt out of that federal program. So then that put us at our beginning of phase 1. Any of those entities that opted out of that federal program, we then were responsible for vaccinating. So within those first real, kind of 2 weeks, just around that Christmas holiday, is when we were doing strike teams to all of those entities within our district, going out with a team of nurses and a team of data collectors to be able to provide those vaccines to those individuals and those staff members. So that's what we were really busy doing before phase 2 opened up. It's important to note that phase 2 has different groups within phase 2. So we've opened to phase 2, but to those first 3 initial groups with healthcare responders, healthcare workers, first responders, and then those over the age of 65. I know there was a lot of confusion because that bullet point with 65 and older was also lumped in with those with comorbidities who are under 65. The only thing that prevents us from moving further these groups, further into that comorbidity group, is really inventory. And so it's that they kind of had to make a natural break there to be able to have us kind of accommodate the population that we're currently serving. So then that's where, you know, you'll see as we move forward, those notifications from the portal and that type of thing come available as we move through those groups and then into phase 3. Is that clear as mud? Do you have any questions on that part? Okay, good. So I really like to talk about what we've achieved so far, because a lot of that, you know, it's the nature of kind of our world right now, is that we always hear about what's not working, and not often about what is. So just on that, to really highlight phase 1, you know, we moved really rapidly within that. Our district has higher population volume than many other of the state districts within the health department umbrella. And so with that, we also had, you know, a ton of nursing homes and long-term care centers that we serviced, and then really having to work through with some of our hospital partners and that type of thing to make sure that we were able to facilitate vaccine distribution with them. You know, I think it's very easy to think with this that you just give them a bulk of vaccines and that's it. But really with these particular vaccines, especially when we were starting off with Pfizer, you know, we had to think through several different points of logistics, including that ultra cold storage. When you take it out of ultra cold storage, you have to use it within 5 days. If you open a vial, you have to use that vial within a certain few hours, and you don't want to waste anything. And then on the other side of that, there's reporting requirements. So every entity in the state is required. They're really called OSIS forms. It's essentially the electronic medical record system that we put all of these administered vaccines in, so that when you come back to the health department and say, oh, I need my shot record, that's where we pull it from. So with vaccine distribution, from our level to the federal level, they're watching those OSIS forms. They're watching that inventory come out. And so we're required to get that information in within 24 hours after that vaccine's administered. So there's a lot of moving pieces on this that, you know, when we have the conversation about moving into being able to have pharmacies distribute it or other entities distribute it, we've had to walk really closely with our partners that we do have helping us out, simply because of all of those measures and responsibilities that we need them to also hold up their end of the bargain with. So I've been super proud of our side, our team, and just our partnership. So as you hear about class and urgent care or ME labs, so that's infrastructure that we're setting up on the local level, and you know, being able to walk with them through that administrative process to make sure they have all their ducks in a row to be able to administer this vaccine. And so then from there, we are able to kind of help flow inventory their direction, liaison with them with the state office to be able to make that happen with them, to provide additional points of access for vaccine distribution. Just on that, you know, Klassen, we've been really thankful for them. We've been able to use them as really kind of our pocket for individuals who do have limited technology or limited internet access. When we get those calls or when we get that information from the 211 hotline, we're able to funnel those names and that contact information to class and urgent care. And so when they have initial appointments, that's who they're scheduling. And then they open up the rest to you know, general public. And so we're really thankful to be able to have that kind of system in place, so that when we are doing our larger pods, we can have those all coming off of that scheduling portal that I'm sure you're seeing. So super happy and proud of our partnerships. Additionally, you know, we have been, our district stood up what they call command. So with emergency response, you know, you have kind of everybody's other hats that you activate. So that means that for response, my public information officer hat was activated, and we stood up response really, I think, before anybody else in the state. So we're coming up on a full year of being full on COVID, starting with the testing and the contact tracing and all of that. And so as vaccines have come onto the scene, we are some tired and weary souls, but we're, it's a really great team. We're working with a really great team in our District 6 health departments. So everybody's really sharing the responsibility that we can. What we've been able to shift off of more of our clinical staff, more of our nurses, and put kind of more on maybe my health education team to transfer their responsibilities for doing case investigations for new positive cases. So it really speaks to everybody's adaptability, their moldability, and just really the team effort that's happening in that we have all of us really trained on all different parts so that wherever there's a gap or there's a need, we're able to fill that, especially with those OSIS forms. So those are things that I'm really proud of what we've achieved so far. We've moved pretty rapidly along the way. And so when we think about challenges, the three things that really come down into play about this distribution are inventory is our primary. I'm sure many of you maybe have paid attention to the news and what's happening on the federal level with, initially we were told that there was more of a stockpile of some of these second doses, that they were kind of holding some back for us, only to find out that they had started really shipping that already in December, which was tough because we have really hit the ground running. And what had been communicated to the state and the local level is that our burn rate of vaccines is what is going to keep us getting more and more. So the initial promise was really, the faster you burn these, the faster you'll get more. And it's not off the table. That isn't canceled. We're still operating out of that system, but that stockpile, that additional inventory, it doesn't appear that we're going to get that at this point. Now, what that doesn't mean is that we're just not going to have vaccines. We expect to get kind of our regular flow of distribution. It's just not going to be kind of a 98% more at one time shipment to us. So I want that to be really clear in that we're not anticipating there to just all of a sudden be this break in vaccines. It's just that we were really hoping to be able to get that big bulk out to be able to really kind of do some large scale pods and clinics and that type of thing to get this vaccine into our citizens. So inventory space is often an issue when we are doing these pods. I'm not sure if any of you have been able to go through our Sooner Mall pod, but within our district, so this is where it kind of comes into play with being district wide. We're trying to set up a flow essentially to where, Monday through Wednesday, we'll do our Sooner Mall pod or our Cleveland County pod. And then Tuesday, Thursdays, we have a pod in Pottawatomie County and in McLean County. And then Fridays, we have a pod in Seminole County and in Grady County. So that's where we're trying to cover really all of our district and trying to share staff and pull staff kind of around to make these big clinics run smoothly. One thing to note just on that is that really, depending on our location, we're running through on a low day, it's probably 600 people. As we kind of started out at our Sooner Mall pod, we started with kind of 800 to 900 appointments, and then figured out our flow, figured out kind of what we could handle from there, and bumped it up to, I think, about 1,100. So at our Sooner Mall pods, we're doing about 1,100 vaccines a day. At some of our smaller pods, like Seminole, it's maybe closer to 700. So I don't have a timeline on when we're moving through these groups. I know that that's a big question, especially kind of, in my opinion, this particular group with 65 and older, with the mechanisms that we've rolled out, so making it very technologically heavy. From my understanding, the state is wanting to give us some time here to make sure that we catch everybody. Essentially. Now, that being said, in 2 weeks, they could definitely open it up to the next groups of this phase 2, and we keep rolling. But from my understanding, they're really trying to make sure that we cover our ground really well with our 65 and older population, because of, you know, kind of the hiccups with the portal and having to rely on all of these knowledge bases that I don't know if I want to care about when I'm 65 or older. So that's the tension that we're kind of in with the timeline. So I wish I had a better answer on that, but we're kind of still waiting on the guidance on that. There, if you all have questions also on the documentation that may be necessary for those with comorbidities, right now we have not been provided any guidance on what kind of proof we will require, if we will require anything. You know, there had been talk about if a pill bottle would work, or if an inhaler would work, and that type of thing. And I think everybody's big question is what kind of manpower is going to exist in order to be able to verify and take that time as we're processing through these clinics. So those questions are really still on the table for us as well. The technology, so with the portal, which if it's helpful, I can definitely walk through kind of a tutorial on the portal side. If you're paying attention to that, there are some tricky components to it. You know, we know that full on online, from our side, we can acknowledge that the portal has some good bones. So at least for that OSIS part, that reporting point, that's collecting all that information that we ask on those OSIS forms, so that then when you come through, we just have to scan your QR code that is emailed to you once you verify an appointment or validate your birthday. And then after that point, as you walk through the administration process, it takes care of all that paperwork for you, and it just does an evening dump into that OSIS system, so it saves that manpower on the back end. That is a pretty hefty side to it. So there's a lot about the portal right now that is in process, even as it's in use, and I think that's a little bit where they landed on having to acknowledge the limitations in doing that, but that they reached a point where they felt like it was functional enough. And when I say they, I mean really the state, that they felt like the portal was functional enough to launch it, and then kind of be able to work around on the things that we need it to do outside of that. I will say, coming from the county side, that a lot of our flow with the state office is really kind of this communication of, this is what's happening on ground, so we would really like the portal to work this way. So that's where, even from our side as the administrators and your side as the users, we're trying to communicate kind of what we're hearing from both directions back to our portal makers, essentially back to Microsoft, so that we can get some of these kinks worked out, to where it's a little bit more clear or a little bit more user friendly. That being said, just back to that, you know, kind of class and urgent care system, we are trying to do our best to accommodate those individuals who are just having just a tough time, and trying to get them on a list that can be another point of access. And then that's really my agenda that I had to kind of hit some highlights. So hit me with your questions. Let me know what I'm missing, what I'm not being clear on.
Thank you for all of that. Here's a real common question that I'm hearing, and that is, I'm in that group that has received my first shot. Now, what do I do to get my second shot? And when can I expect that?
Yes. So there are 2 points to that question, or 2 answers really. And I'll give you probably too much context for that. That's something to where initially, you know, with Sign Up Geniuses, many districts opted in to just carry over those initial first dose appointments and duplicate them 4 weeks out. For us, for our district, to us, that makes the most sense. You can expect what inventory you have. It makes it easier for the client. So for our district, we've received permission to be able to duplicate our schedule. So right now we're working under that system, to where if you come to our pod for your prime dose, we're going to automatically schedule you either 3 weeks if you get Pfizer, or 4 weeks out if you get Moderna. So we're trying to kind of simplify some of those points. Right now, that's one thing that we're trying to work on the portal with, is to be able to carry over that information from those first clinics to just be able to duplicate that in like a closed portal type of system, so that can still continue to live really through the computer that's then going to do that OSIS dump for us. Whereas right now, when we look at our first big clinic that we did 4 weeks ago for next week, we're still duplicating those schedules, but we're doing it offline essentially. So that means we're making everything paper for those clinics to be able to just take it, enter it, and then keep kind of going with those second dose clinics. So for our area, if you're getting your prime dose with Grady, McLean, Cleveland, Potawatomi, Seminole, or Hughes, we're just duplicating our schedules depending on what our needs are. So that means that until there's a mechanism in the portal that allows that to be seamless for the user, we're just saying, you know, come back same time, same place. Don't worry about the portal, even though it will email afterwards to try to get you to schedule your second dose. That's not something that you have to do with our end. Now, that's not necessarily the case for every other district. And I'm sure that many people have gone to kind of different parts of the state to try to get their prime dose. And this is where, you know, this is where I think it would be helpful to have a very unified approach. But right now, the directive there is to go back to the portal. It should email you after you get your prime dose administered with really a prompt to say, okay, it's time for your second dose, schedule here. Now, what that looks like right now in the portal is that there will just be clinics titled boost clinics. And so that's where those individuals who are seeking their second dose, their boost dose, that's where they're advised to schedule into. And then I believe in there's a place to select whether or not you're scheduling your second dose for Pfizer or Moderna. And that's what lets then the county health department know what to expect.
Thank you.
Yeah.
I have a question. And with you're getting both Moderna and Pfizer, how do you determine what kind that you give to people?
So yes, we were trying. Pfizer's what we first had in hand, so that's what we used for our healthcare workers. And honestly, that was probably the best setting to use it for because it was so logistically heavy, and it had so many kind of components about that make it just kind of a little, sensitive. So we were kind of hoping that our public pods would be able to be more Moderna heavy, but our inventory is just mixed. So because we're expecting a regular flow of both, we're trying to set up pretty institutionalized pods to where, Monday we're planning to do Moderna and then do Pfizer Tuesday, Wednesday at Sooner Mall so that we can kind of keep those rollovers going so that then when its second dose comes up, you don't have to change any of that, if that makes sense. So as the person scheduling, there's probably no easy way to know. We're kind of in talks on, as we haven't put very much out on that specifically because we're still trying to get our feet out from our feet under us and being able to kind of have that consistent flow. And so right now that's just kind of the grid that we're working off for our own planning. And then as that continues to kind of be more institutionalized, then we'll try to get the word out a little bit more about, if you have a preference for Pfizer or Moderna, this is when you can kind of look for that. But
okay,
otherwise,
that's what I was wondering, if you have a preference, whether you could even say, hey, I want Pfizer or I want Moderna.
And I don't know if at some point down the road there will be kind of that capability within the portal to then be able to be specific. I imagine that won't happen until there's a heftier supply and some less demand. Right now it's kind of like you get what you get and everybody kind of keeps rolling.
Thank you.
Sarah, if you get what you get, if you get Moderna the first time, Moderna the second time is required, or
yes?
Okay.
Yes, you want them to stay Moderna, and Pfizer. I do want to. Do you have any other question there?
Well, I do. Go ahead, though.
Well, so on that, so the recommended window, and this is kind of news coming out from the CDC as well, but initially, so Pfizer, they say it's, most effective to have your dose at least 21 days out. So that's 3 weeks. With Moderna, it's at least 28 days. So that's 4 weeks. There's been generally a 4-day grace period, how they've called it, with both of those. But what we've recently heard and what the CDC has just come out with is that, really, you have like more of a 6-week window. So that is one thing that you're going to probably see a lot more messaging come out with from the state, just in that if you're having trouble getting your second dose, don't panic. You know, you have more of a window than what was kind of initially brought out to us. So that's kind of, I think that came from the CDC. What day is it? It's late last week is when we saw kind of that recommendation change.
Sarah, I asked you last week, how could the community best help you? How can our Rotary Club help you?
Yes, thank you, Joan.
Seniors and the vulnerable populations.
Yes, so when we talked last week on really, you know, what we've sort of talked about is if entities, you know, kind of doing this of having you know, teach a man to fish is the phrase that keeps coming to mind on things. So as you're getting into the portal and you're kind of figuring it out and navigating and getting your appointments, you know, helping your neighbor, helping your friends. Initially we tried to sort of be able to help callers call in, get registered with an email that we could use just as our District 6 email. But then, you know, that left us kind of hanging when it came time for them to be able to schedule. And so that was kind of a mess. So we know that in terms of going through the portal, it's really most helpful if friends and family are helping friends and family, so that then if you can use your email maybe for another friend who doesn't have an email, then you can kind of help keep watch on the portal for them and then kind of help register them for an appointment time. So that's been one thing that we've really tried to encourage. And that's where, you know, to do a portal tutorial, I'd be more than happy to do that, or schedule another time to do that. But that would be a huge help. Our calls are, we're inundated with calls, and we have really limited staff, especially as we have so many of us at the pods to kind of make the world go round there. And so really just kind of sharing information that if you are seeing it on our Facebook or seeing it online, just to kind of to calm some anxiety and to kind of funnel that information as you see fit. Another thing that we have thought about asking for is that just if entities involved would be willing to kind of offer up a person or a staff member or a phone line to be able to be another source where people can ask questions about how to walk through the portal, or for kind of some extra general information. We're at a point where information sharing is really our one thing, because we can't change our inventory, you know, and we can't affect how quickly the appointments go away. And so that's where we're kind of at this gap stop of, you know, we're pushing these vaccines out, but then are really limited on how much we can walk through the process with people. I also told Joan that we would welcome any snacks and water.
Oh, that's a good idea.
So.
Sarah, I have a question.
Yeah.
I know it applies to both me and my husband, who registered on different days on different computers. Neither one of us have received a return email with a link so that we can schedule an appointment. And of course, it doesn't allow you to go in and do it again. So I'm at a loss for what to do next.
So the unofficial workaround, and this is coming from even some of the questions that I've asked at the state, is kind of what do you do in that instance? And the nice thing is that because you can use your email again, you may have to adjust in order to re-register, you may have to kind of change your initial, like your middle initial. So if you put in your middle name, changing it to an initial, that type of thing, so that then you can, because especially for a lot of people who pre-registered when it kind of went live, when it wasn't really ready to, that's where we see a lot of people kind of get left in the dark without those emails. The other side to that is that if it categorized you incorrectly and put you in a later group, then you may not get that because we're not open to that group yet.
Okay.
Sarah, are you saying to re-register, you should change your email address by just changing the initial, or just re-register with, instead of using a full middle name, just the initial of the middle name, and re-register on the same computer and same email address?
Yes, same email address. You can do same computer. Yes. And so it's because if you use the exact same initials or the exact same names, it's going to say that you're still in there. but we don't really have a way to like be able to circumvent it and password change or anything like that. So our kind of recommendation has just been to kind of re-register if you can with just a little bit of a slight variation, so that it's still you and it's still very clearly you, but you can keep your email in there and then hopefully get that email back to you.
I have a couple more questions. One of them is how many doses are in a vial, and however many there are, do you see or are you aware of waste because they can't use part of a vial?
So we, to start off, generally with Pfizer, they told us to expect about 6 doses per vial. Sometimes we get 7. With Moderna, it's about 10, but sometimes we get 11. And so that's where we're very careful. If you come to our pod, you probably see kind of people running in behind the curtain a little bit every once in a while, because we really watch our vials, because we don't want that waste. So if we're getting, 11 vials, we may have brought several more doses to our pod, but we may not tap into them at all because we don't need to, as we're getting more doses out of those 1 vials. I will say that, I think initially at our Sooner Mall pod, as we were kind of figuring out flow and that type of thing, we had days in the beginning where we did kind of have to pull in a few people to not waste anything. I would love to think through a better system on how to do that. And I think, we've tried different things, but it's sort of everything gets overrun when you kind of start to offer up doses. But I'm over answering your question. So that's what we're seeing. We're generally seeing that 6 to 7, 10 to 11. And then as we're winding down through our pods, we're cutting some of our nursing staff so that we can have them function off one vial here and there. So we're trying to really eliminate, we don't waste it. We definitely find arms to put it into, but we're trying to get down to where we're not having that outlying group be anybody not in our appointment time. And we have also gotten to where if it's at the end of the day and we do have any extras, we're definitely trying to find those within our groups that we're already offering it to be able to give it to them.
Okay, thank you. And then my second question is, and I was fortunate enough to get a slot fairly easily, just good timing, I guess, or good luck. But when new appointments come on board at locations within your, and I can't remember if you're talking about a zone or a district or whatever
district,
you cover, is there any, or have y'all talked about protecting those appointments so somebody from, and I don't know if this happened, but somebody from Boise City can't tap in and come to Norman Sooner Mall and take one of those doses and take it away from some deserving person in your zone?
This has been a continual conversation. From my understanding, this is a question we've had, especially as we bump up to the metro area and know that we get, for all of our services, many residents from Oklahoma City County. And so it's really comes down to, I think, a combination of funding restrictions that prevent us from being able to limit our services to just one geographical location to our counties. So no, there's not that way to protect that or prevent it. And I think this pattern of seeing people kind of drive to different locations as the conundrum of the second dose issue kind of continues to roll, I think that you may see people wait maybe a little bit longer to try to get one closer to home, especially if we see more districts pick up that second dose kind of just automatic duplication system. But there's really no telling on what will happen with that. So, I mean, we see the issues and we would really like to be, kind of exclusively vaccinating our people. But it's not really kind of what is an allowable kind of boundary.
Okay.
I was fortunate enough to get a vaccine yesterday in Clinton.
Mhm.
And I was fantastic because when I was looking before, as you were saying, it was all over the map. Nothing in the metro was ever available, even though I'm in Cleveland County.
Mhm.
But now, should I try and get my second back where in Clinton, or is there going to be another notice that goes out that says, here's where some are available, or that situation? I'm glad I've got my first shot, but
Mhm.
do I need to get my second shot at the same location where I got my first shot?
Did they give you any specific directions when you went through?
None.
Okay, so then
It
they're
was just, it was just, do you feel okay,
Mhm.
etc. I mean, there wasn't additional, and that wasn't, I mean, we were there for a period of time that you have a waiting period to make sure
Mhm.
no reaction or anything. And people, as soon as that was over, they just went up and left. There
Yeah.
wasn't anybody stopping, we'll have you rescheduled, your second shot, or any type of information that was given out.
So that sounds to me like they're expecting you to go back through the portal to schedule your second dose. You don't have to go back to Clinton, especially as a lot more of these first prime dose clinics kind of have to accommodate a greater amount of boost dose clinics. You should see more of those clinics pop up on the portal. And so it's going to be, again, where you find an appointment that is comfortable for you. I think the component of just allowing individuals to have to go through for their second dose and then select Moderna and Pfizer it sounds like a logistical nightmare to me on the health department side to be able to accommodate both of those inventories in the same day, but they'll do it, and they're going to do it well, I can guarantee you. But yes, so you should be able to
Quick
make that
question.
selection as you go back through.
How do you know from the information you would have received which one you got? And does it make a difference to say, well, I got one and I got the other? Because I'm looking at the information I received, and maybe there's something I can't see the forest for the trees, but it doesn't tell me anything about what vaccine that I was.
Did you receive a vaccination card?
Yes.
So on that vaccination card, it's going to have the kind of first dose that you got. It's also going to include the lot number from the batch that you had, all of that information on it.
Well,
so
when
that
you
should
see
be
a vaccination card, the only thing I received is an email that had the vaccine, the information, the location, etc. But as far as giving us anything when we left, no.
That's very interesting. Did you go to a health department?
Well, it was the Custer County Health Department at the fairgrounds in Clinton.
Well, that's very interesting. What's your email address?
Hey, Sam,
Yes.
I think you got a flu shot. I'm just kidding.
I don't know. No, I mean, my email address, samott@samott.com.
Okay.
My full name is Sam Ott.
I'll try to figure out what information I can. That sounds very interesting to me. My guess would be that it was probably Moderna, because that's just generally what more of us are functioning off of. But I'll try to figure out who I can connect with at Custer
And that
County.
was my question. Do I need to make sure, or anybody else in the same situation, that when you get your second shot, it matches your first shot?
Yes, that is the recommendation that they still are continuing with, is that your prime dose would match your boost dose.
Sarah, I have a real quick question. I got my first shot at Sooner Mall, and there seemed to be plenty of volunteers. It went very smoothly. And I've seen on the news where some of the health departments were asking for volunteers. How are y'all fixed up for volunteers for your centers?
Thanks. That's a great question. All of us are going through the Oklahoma Medical Reserve Corps. So that I can put that website in the chat in just a minute, but that's really just a place that it's a national program, I believe, but this is specific then for Oklahoma. And it essentially runs kind of all the background checks that you would ideally have for volunteers. It also can delineate between medical capabilities and non-medical capabilities. We are open to having both types of volunteers. And then that's an easy process to where we can send an alert to MRC facilitators. And then from there, they can just kind of do an all call, and those who are available can come back through and start volunteering with us. So we've loved our MRC volunteers. There have been a few that have really stayed very consistent with us, and it's great to have them on board, especially as they're returning.
Sarah, you were talking about needing a phone line and staff. Could you be more specific if we want to try to help you find that?
Yes, John, I've kind of thought about it since our last conversation, and it's a logistically interesting ask. And this was so really what would we? I'm trying to think of how to make this low hanging fruit. I think really specifically, we're talking more through like probably more public facing touch points, organizations who have a more public facing touch point, to where then if they're getting natural calls for other services or other issues, or if they're just you have your clients and your clients have you. And so if those groups kind of who have institutionalized, an institutionalized public could really try to become an additional arm of resources and information, that's really what we mean. I think the logistics of trying to then get out a whole new number that people could call for information would just be kind of too messy. So I think that's kind of more, if you already have people that you see or have coming to you for whatever information, if you can kind of tack on vaccine information in there, then that's helpful.
Sarah, my radio station reaches 36 counties, including yours. Could you indicate to me the best way to reach you?
Yes. So my email, I love KGOU. Okay. My email is sarahk@health.
You putting it in the chat?
.gov. Yes.
Yep. There you go.
And then I do have and then this is my office line. So please don't release that to the public, as I'm not the greatest source for public calls, but yes, that's also a good way to reach me.
All right, great. Thank you very much. You're going to be hearing from me.
Thanks.
Yeah.
And Sarah, you said at the Norman Pod, you could use water and snacks. You have about 40 volunteers there at a time.
Yes, we're to make that run smoothly. And that includes our National Guard and those MRC volunteers and our staff. So, there are days to me where I'm like, do we need this many people? But then when you have to kind of think through traffic control and different shifts and just accommodating, breaks here and there, it's really been helpful to have kind of that volume. And so we have, I think on the high end, usually 47. I think that's what we had on the MLK holiday. And that's because, you had volunteers who were able to come since they didn't have work, whereas that's not necessarily the case every day, but yes. And we've had a few different, real thoughtful people drop by cookies or, and that's just really helpful when you kind of have these long days and not necessarily a ton of time.
Sarah, go ahead.
Go ahead. As far as working with United Way and the agencies, working with those elderly and vulnerable, have you done a Zoom call with all the United Way agencies through?
I love Diane Murphy's haircut more than most things. I have not had a minute to really be able to proactively go out, and I need to contact her and kind of set up the same thing. And so I think that's a great idea, and I definitely am going to write that down so that I make sure to follow through with that. Because
would it be easier for them to call you? I've been in contact with them.
It wouldn't hurt. But this is the first week, at least for me, that I'm kind of in a more balanced spot because the pods are up and running. And so I'm kind of back in the office, able to tie up some loose ends that haven't necessarily been able to over the last few weeks. So hoping to make some headway there. But thanks,
Sarah,
Joan.
Yeah, I'm sorry to cut everybody off, but it is 8 o'clock, and it's funny, we got started early, and I thought, oh, I hope we've got questions, and you guys have outdone yourself. And I know you could probably ask more questions, but thank you, Sarah, very much for being here and answering our questions. And
yeah, thank you.
luck in your efforts.
It's a vibrant group.
I'm sure you'll be hearing from several of our people.
Yes, great. Yes, bring it. I may refer you on kind of as I can to other people who maybe can answer questions better than I can, but I'll try to get you resourced.
Understandably. Thank you.
Thank
All right,
you.
Rotarians. Thank you for joining us today, and go out and have a great week and open the opportunities. And we'll see you maybe tonight at happy hour.
Thank you, Sarah.
everybody.
Thank you,
John.
Sarah.
Thank you, Sarah. Good job, Sarah.
Thanks. Have such a good
Yeah,
day.
good job. Thank you.
Happy Tuesday.